Good morning, good afternoon, good evening, colleagues. Let's talk about how we can influence organs with taping on the skin. My name is Esther Deroux. I'm a certified physiotherapist and have been since 1977. I've specialized in various areas and have always been very aware of the importance of skin. And we are the lucky ones. We can use our hands to contact patients, use stretch, and also use tape. And this presentation is about how we can use the tape on skin, on organ zones in the skin. The interesting question, and some really don't believe it's possible, is that the fact of, can a piece of tape actually influence organ dysfunction in the body? Can, in this case, primary dysmenorrhea be influenced with elastic therapeutic tape? Do we need to know about organ zones in the bindegewebsmassage for a full understanding? Yes. Do we need to be able to really know the method and treat with bindegewebsmassage? No, you don't. The first time that it was ever described on paper was in 2009. And yes, we need the Kibler technique as an assessment to see if our application is correct, yes or no. The application described is really meant for the primary dysmenorrhea, the most common form of, defined as a painful menstruation in the absence of any sort of pathology, something many women have suffered from or still suffer from. Very strong contractions can be really painful, not only in your stomach but also in your back, and we have the extra problem of the tension on the ligaments and nerves causing pain as well. We talk about the organ zones in this case, but what we are actually describing are the Head's zones, as discovered and described by Sir Henry Head many years ago, as something that every student knows about, but they have never really been fully understood. But that they are there and we can use them to assess is definitely the case. In the bindegewebsmassage method, they are referred to as the organ zones. The bindegewebsmassage method, as developed by Mrs. Dicke and described further by Dr. Teilrich Leube, has shown us that yes, we can influence organ dysfunction through these organ zones. Colleague Elizabeth Dicke developed the method in very early on in Germany, and called it the neural therapy because she knew it was based on the Head's zones. It was a massage method that was looked into by more important people, doctors, and at the Heidelberg University. And this was all happening before the Second World War, but of course we didn't really get to know about it until after the Second World War. It was introduced to Holland in the 60s, and it became mainstream, and everybody was taught this method when becoming a physiotherapist. It was it was one of the massage methods you were taught. Dr. Piet and Mr. and Mrs. Sachs-Piet introduced it, physios, doctor, introduced it to the Netherlands, organized courses, and gave a lot of postgraduate courses in that time. It did spread around the world. Of course, a lot of German-speaking people were spreading it around the world, but it was really misunderstood often because it was translated as connective tissue massage, which some of us realize it can be done in many ways. This is a really specific method. We know that bindegewebsmassage can have effect on organ dysfunction. The method has various ways of various techniques applied to the skin, really stretching the epidermal layer to the dermis, a deeper technique that is more in the dermis, and a technique that goes a little deeper and tries to stretch the dermis to the superficial fascia layers. Now, if that works, the interesting thing is, would tape that can be applied with stretch or to stretched skin have a similar effect? And And the answer is yes, it can. We are learning more and more about the skin, how skin moves in certain physiological directions, that epidermal cells can change shape under stretch, and talking to Mrs. Pietzaks, who has used bindegewebsmassage for a lot. I spoke with her regarding tape, and yes, she uses it and has positive experience with both, and also talks about the fact that organ zones and taping on organ zones can be done on children as well. And a number of studies have been done, not only about dysmenorrhea, but about different organs and how they can be affected positively with tape now. Nobody's skin is really the same. That skin, as you can see in these 8 pictures, differs, and that can really help you assess in the bindegewebsmassage method. The organ zones have been mapped, and you can find them in all the books and online and on in Facebook. And you have all seen them, maybe even without realizing. Follow the arrows everywhere. You can see either swelling, or you see these parts that seem to be pulled inwards, as in here. Lots of these organ zones are actually visible. Not only are they visible, they are also palpable. Now, the epidermis is the only layer of the body that we actually apply tape to, and we know that it has all sorts of positive effects. That we don't understand exactly why everything works does not mean it doesn't work. The important work that I know about that really does show what tape does to the human body is the ultrasonar imaging that shows us that fascia and muscles really contract not only near the probe, but 20-30 centimeters away. Functional MRIs have shown activity far away from where tape is planned, and all these methods, the 3D motion analysis, the dynamometers, the blood samples, all showing effect. The application that we are talking about now, and we discussed the details of, are the ones described in the Medical Taping Handbook in 2009. 2 tapes, one applied on the back, on the organ zone, and on the front to support the anchors and the ligaments anchoring the uterus. The Kibler technique is used to assess the feel of the tissue, and changes after applying tape should be visible and palpable. I have found that applying tape with very little stretch, as 0 to 10%, on stretched skin is sufficient to have a good effect. And as you can see, applying 1 piece on the stomach only is often enough. So this application, as described by Pineapple in his book, has been copied a lot and has been studied a lot, but more people have applied tape to patients or girls and ladies with primary dysmenorrhea, and they have used different applications. So we are not discussing, and they're excluded from this list. What is also excluded are studies that have done more, so they've used tape and an application or a modality. The real research has been, and as you can see, it's from 2009 on, there's been sufficient evidence of good effect. And the really interesting research that has just recently has come out is the following. This randomized sham-controlled trial showed that the KT application to the sacral area, the organ zone, and the area on the stomach as described, compared to a sham application and to controls, that the best effect was in the group that tape was applied in. And this study, comparing 2 methods, yes, but also including a placebo-kinesio group and a placebo group. So again, effect shown in this case is that both methods work. So the takeaway is applications to the organ zone, and possibly added by applications as shown in Medical Taping Handbook, can be very effective. Enough studies have shown that. Tape does not have to be stretched that much, but needs to be applied to clean skin. And yes, you can teach your ladies how to apply themselves. But I would like to add that I am not in favor of self-help. So people, yes, you can go online and find how to apply yourselves and buy these tapes yourself. There are enough studies showing effect. But what I have found is that often we use beige, but beige and blue can be effective. And experiment a bit. Don't always follow this application. Start with the organ zone. Sometimes that's enough. As I showed you earlier in the other slide, applying a transverse application across the midline can be enough as well. You don't always have to have that whole cross on the stomach. Summarizing, there is sufficient evidence showing that the elastic tape application, as we discussed on the organ zone and on the stomach, have very positive effects on the symptoms of the primary dysmenorrhea. Of course, you need to take good care of the skin and apply with little stretch to clean skin that has been stretched. And once you've shown the ladies, they can take over. Any questions? I'm happy to answer. Please send me an email.